For this video, I wanted to do a little bit of an examination on somebody who's presenting maybe with neck pain, but their primary complaint is shoulder or even pain going down into the arm. And what we're trying to distinguish here is the pain in a shoulder or in the arm, or is it radiating or coming from somewhere else? And commonly that's the neck. So I'm not going to go through the whole exam. You can see the exam for neck issues, and then we'd be repeating that in this circumstance. But I'm going to be focusing on someone who I suspect has more of a shoulder problem. So Claudia, if you can stand there facing that way. And again, I'll start by looking at just basic balance, looking at the skull level, seeing if she has any head tilt, looking at the heights of the shoulder, making sure that they're equal, going down to the pelvic area, seeing if that's level, and also looking at the feet, because again, everything starts at the feet. So we want to see, is somebody flat-footed? Are they flat-footed both sides, one side? Is their foot pronated, which means if you look at their Achilles tendon from behind, it's bowing in. And the biggest thing again is we're looking for one side being different than the other. So that becomes real critical, and then we'll have you bend forward. And here I just want to see if there's any curvature to the spine at all, because that can affect, especially if the curvature is up high, that can affect shoulder issues. And one of the things we take a look at is one side of the back a little higher than the other? That can be an indication that she does have some curvature. And then you can come back again. And then just to get a general idea, extend backwards towards me. And I just want to see, how's the spine in general? How's the gross spine moving through here? And we may go through bending to each side, and I'm looking at how the upper back is moving, and then to the left, and then holding the pelvis, rotating to the left or right, and then left side. Yep, you can go the other way. And that is the basic standing portion, and then we come to either a sitting or a standing, but I'm sitting or lying down, but we're going to go to a lying down position. So if you can go on your back, face up. So in this circumstance, we're going to be, again, and you can look back at the video on neck, but I'd be doing a basic neck examination at this point and seeing again if we can reproduce any of the pain that she's complaining about in the shoulder and arm. Even though I suspect a shoulder problem in this case, we still want to check for the possibility that that pain might be coming from another area. But if we're looking at the shoulder, we want to see what's called passive range of motion. We want to see that her arm can go back to a fairly normal range, and that's pretty good, and that's called external rotation. And then internal rotation, she actually has pretty good motion there, and we can check flexion and abduction, and then we can combine some motions, doing a little bit of external rotation with some extension, and a variety of different maneuvers like that. And again, we're looking for not only range of motion and flexibility, make sure that those are okay, but we want to see if any of those are pain producing. And we can, because the patient's not using their muscles to move, we can take muscles out of the picture a little bit more and stress the ligaments when we do some of this testing. It's a distinction between muscle and ligament issues. But if we really want to test the muscles, we can have her hold in this position. Don't let me pull in this position. Go ahead. Good. So the external rotator muscles are pretty good. And then you're going to press down. Internal rotation is pretty strong. We can check what we call abduction. Keep your elbow straight. And I'm going to try to push it against your side. You hold it out. You hold it against me. Good. And she's got good strength there. And again, she can have good strength but still painful, and that's important for us. And then we can have her hold here. Don't let me press down. And then press backwards towards me. Good. And then let's bring it across, hold there, don't let me bring it, and then bring it out here, and don't let me push it in. So we're checking for these different groups, particularly the rotation groups, because one of the more common things that people have with shoulder issues are called rotator cuff problems. And you can have a tendonitis, You can have what's called an impingement. There are various things that happen to the rotator cuff. You can get tears, ruptures, which are more surgical procedures that are needed to resolve those conditions. So that is at least part of the examination that we would do. And again, we're combining that with neck and upper back issues as well, and stressing those tissues, because if that's bringing out the shoulder pain, and that's the cause of the shoulder pain, we wouldn't suspect that checking these shoulder muscles would necessarily reproduce that pain as well. It can happen, but we would suspect if pain is coming from a pinched nerve in the neck, that the testing on the neck is what reproduces the pain and not the testing in the shoulder. So it's just one distinguishing factor. Typical shoulder exam, and thanks again for looking at the video.